We have more important guests for you lined up on the program today. Dr. Peter Chitong, infectious disease specialist from University in California, joins us live. Now, thank you so much for taking our time and speaking with NDTV. Doc, I first just wanted to understand the situation in California at the moment, set to be the epicenter of the raging cases that are coming out in the United States. Take us through that.
Well, it's very dire in California right now. When you look at what we're looking at, it's kind of scary because we're looking at the capacity of the ICU beds. The fact that we're looking at that metric is very, chilling in itself. So we have 0% capacity in Southern California and 0% capacity of ICU beds in the Central Valley. In the northern part of the state, we're still at around 12% capacity, which doesn't give very much give in the system.
That's quite scary, 0% capacity over there. But what, according to you, has led to this surge? Is it Thanksgiving? Is it Christmas?
So there are three reasons why we're having a surge in California right now. The first is that it's colder, so there's less opportunity to gather outdoors. The second is that, there's pandemic fatigue, which some have recasted as pandemic resentment because everyone is very tired after being, pretty good for many months. And the third reason is that we can only be as good as our neighboring states. We have a huge population, so we were quite good in terms of numbers, but the surrounding states and the rest of the country was really surging. So that because of travel in the United States, that's the third reason. And, I would say that this is not even the Christmas surge yet. We expect a Christmas surge on top of this in about 2 weeks. So this is reflecting the Thanksgiving surge. So we're expecting a surge on top of a surge in about 2 weeks.
So the coming winter and January is going to be even worse now. But tell us, what exactly is the reason behind this? US again has the vaccine. How is it that it's not being controlled yet? We do understand that a vaccine also takes quite some time to actually show its effect on the ground.
So unfortunately, the vaccine, although really promising, and I think a lot of people are holding on to vaccine as hope, is not going to be the solution for the surge. It takes 28 days after the second dose of the vaccine, and the two currently approved vaccines in this country, they require 2 shots. So 28 days after the second shot is when you get the full immune response. It's not going to be here in time for all of the surge, and it's being rolled out very slowly. So only right now we're seeing healthcare workers and nursing home residents get it. I haven't even gotten my vaccine yet, and I'm taking care of COVID patients. To tell you that, we don't have enough vaccines for all the people. So we're just hoping what the vaccine would do, because we expect the surge to go on for some time, at least a month or more, is that it will keep our healthcare worker force relatively healthy from COVID. But there's no vaccine against burnout or mental fatigue, and that's what I'm worried about most.
Well, thank you, Doctor, for that. No magic wand over there. That's the only underlining thought after speaking with so many experts across the globe. So remember, always wear your mask and stay indoors as much as possible.